We all know that Medicare is health insurance for older Americans, usually at the age of 65 years old. And that is true, but it can also be had earlier than 65. But how and for who and for when? Hi, I'm Michael, and this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, don't forget to like and subscribe, because it will help you to stay up to date on the newest Medicare changes, the newest Medicare options, and also how to make more, better informed Medicare decisions. All right, here we go. So let's first talk about how Medicare in general works. Medicare is a health insurance program that is run by the federal government, and it is composed of two parts, Part A and Part B, which are known as Original Medicare. There are other parts like Medicare Part C and Part D and Medigap and Medicare Supplements and so forth, but those are not Original Medicare. And we'll save those in-depth discussions of those non-Original Medicare parts for another video. Now, to be eligible for Original Medicare, the criteria is quite simple. One must simply be a U.S. citizen or a resident, and they must have also have lived in the United States continuously for 5 years. And that's pretty much it. To get a portion of the Medicare Part A for free, though, someone would need to have had worked in the United States for a minimum of 10 years or 40 quarters, or had a spouse that had done so instead. And at that point, then the Medicare Part A monthly premium has no cost. But the Medicare Part B portion still is going to have to be paid, which for 2024 is $174.70 a month. Medicare is usually triggered at the age of 65 years old, when traditionally Americans and retirees would also begin their Social Security benefits. But we all know that the retirement age is going up from 65 to 66 to 67 to whatever it goes to by the time people my age end up getting there. That aside, 65 is still the standard age for Medicare, and is likely the age that 95% of the people on the Medicare program will start. But not for everybody, and in specific situations, it's possible to start Medicare early before that 65-year-old age. The first way that someone can qualify for Medicare prior to being 65 years old, and really the most common way, is going to be as a result of disability. More specifically, this would be Social Security Disability Benefits, or SSDI. For someone who meets the criteria for being disabled and qualifying for Social Security Disability SSDI through Social Security, they are generally eligible to enroll in Original Medicare once they've been disabled for a minimum of 24 months, which is referred to as the Medicare waiting period. It is at the end of that 24 months, when somebody is receiving Social Security disability benefits, that they can qualify for the health plan, and oftentimes are automatically enrolled. In fact, many times we have clients who come in and they are in complete and total surprise by the fact that they got a Medicare card at all. They got it in the mail with a start date on it. They just noticed it was there, and it's because Social Security does automatically enroll a disabled person, oftentimes who's on SSDI, after that 24-month period. So that is the first and most common way to get Medicare prior to the standard enrollment age at 65 years old. Now, another way, and to a lesser degree, and really fortunately for a lesser degree, there are other ways to get enrolled into Medicare prior to 65 years old, specifically if someone has specific illnesses. And it is specified by Medicare as a qualifying illness to qualify for the program. So for example, if somebody has something like end-stage renal disease, or ESRD, then they are going to be eligible for Medicare if they meet the minimum requirements, primarily that they are U.S. citizens and residents, and that they have worked and paid into the Medicare program for a sufficient amount of time, or has had a spouse that has done so. Also important to mention is that the Medicare waiting periods are different from the standard 24 months for folks who are on SSDI, for someone who has end-stage renal disease. In this case, for ESRD, the eligibility for Medicare can be done at any age and will start after a 4-month waiting period has gone by. So that means that Medicare can start on the first day of the 4th month once a person starts their dialysis. Additionally, in the case of ESRD, it is possible to have Medicare begin to work retroactively as far back as 12 months, meaning that if you apply 12 months after you are diagnosed with end-stage renal disease, you can actually have your coverage start 12 months prior and get those costs covered from previous months. Unique to the ESRD situation is that once a person no longer needs dialysis or gets a successful kidney transplant, Medicare will end 12 months after the dialysis has stopped, or 36 months, 36 months after the kidney transplant. So for ESRD specifically, Medicare is a program that could end and basically stop and have to restart once they turn 65 if they stop taking dialysis or if they get a successful kidney transplant. Also, as a last avenue to enroll in a Medicare prior to the age of 65, it is possible to enroll if a person is diagnosed with Lou Gehrig's disease, or ALS. Similar to ESRD though, there is a truncated timetable for someone who is diagnosed with ALS to get enrolled into Medicare, because once their disability benefits begin, they will also be eligible to enroll in Medicare, which only has a 5-month waiting period after the diagnosis of ALS to enroll. So those are the 3 main ways that a person can have an opportunity to enroll into Medicare if they're under the age of 65 years old. But if someone is under the age of 65 years old, there are also some other considerations and alternate coverage options they may want to consider. Yes, Medicare is a great program, but in some cases, there may be better options. One thing to consider, especially for lower income individuals who don't qualify for Medicaid, or Medi-Cal as it's called here in California, is to look at the health exchanges, where it is possible to get a health plan that has a much lower out-of-pocket limit cost than what they can find on Medicare, or has lower prescription drug costs that are capped at a certain yearly amount rather than having a functionally unlimited cost for prescriptions through the Medicare Part D plan or Medicare prescription drug plan. Furthermore, the cost for Medicare for someone who doesn't qualify for any of the financial assistance for Medicare through something like Medicaid or low-income subsidy LIS or Medicare savings plans, the health exchange can offer up to 100% of the monthly premium to be paid and have very low copays and out-of-pocket maximums and caps on the yearly spending, which again, Medicare doesn't have. So that's just a consideration if someone is under the age of 65 and they're trying to figure out whether they should try to get into Medicare or should look at the other options. There are other options, but again, it's something you would probably want to talk to a professional about to get a better understanding. So overall, looking at getting Medicare prior to the age of 65, it is definitely possible, especially in the case where someone is disabled and is not able to work or has some specific serious illnesses. But for someone who is just retired early, it may actually not be a good fit. In those cases, again, they should look at the health exchange or go directly through a private health plan to get the coverage for the healthcare that they need while they're waiting to get to their 65th birthday when they can actually get Medicare. Additionally, like I said, they may even find some aspects of the under 65-year-old plans are better than what they can get on Medicare and what Medicare has to offer, but you just gotta know where to look. Now that's gonna be it for today for Michael's Medicare, and if you have additional questions or you wanna get more information about your specific situation, feel free to reach out to us at the information below or put a comment down in the comment box or give us a call or check out our other great videos on our socials on the YouTube and on the Instagram, and we have new content every single week. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and thank you and goodbye.